This is Dr. Raj, your host of the Weekend Warrior Show. I'm here to treat your sports injuries and joint pain and keep you out of the operating room. I'm here with my co-host, Jani. Excess weight, obesity, is the biggest reason behind us being the U.S. having the highest rate of joint replacement. Isn't that crazy? What do you think about that, Jani?
Dr. Roz, you know what I think about this. This is absolutely ridiculous. And I blame the food industry. I blame our government. I blame the parents and our education system. There are so many things that we could be doing to help alleviate this problem. We could be educating our young people. The food industry needs to change. The government needs to put regulations on some of these, the amount of sugar that is put into all our products without us even knowing it. Everyone needs to read labels. I mean, there are so many things that we need to do to help this problem. This is so preventable. That Ebola, we've got like crisis like freaking Ebola, right, where we don't know how the hell that's going to affect. That could have catastrophic, consequences. We can't potentially maybe even control that virus, but we are dying because we are putting too much food, junk food in our mouth. It makes me mad.
But you weren't
expecting that answer, huh?
I love that answer.
What do you think?
What do I think? It's crazy. We're the most powerful, most beautiful nation in the world in so many ways, but yet our media is focusing on, like you said, on this one or two viruses, Ebola, and not even focusing on what's killing us, what's killing our kids. And I see it day in, day out, because what's special about me in Beverly Hills being younger than different surgeons around, I don't get your 70 or 80-year-olds who need replacements. I'll get younger and younger people with end-stage arthritis, end-stage changes because of themselves. Two reasons. Number one, environmental. Second one, genetics. Now, we can't control genetics, but we can control environmental. At least we can't control genetics now. That's a different topic. But environmental is every extra pound you have is 5 pounds of force with every step for your knee, your hip, your back. You're wearing it out. Now, if you have 10 extra pounds or 20 extra pounds or 100 extra pounds, every step, 100 extra pounds, which is feasible, I see it all the time, is 500 pounds of force that goes through that cartilage for your knee as you're wearing it away, as it's scratching away. And what happens is this cartilage is supposed to last you to 100, to 90. That's what God meant it for it to be. I mean, God didn't meant for all to have joint replacements when we were 20. He didn't program that in our lives. I mean, just going on a simplistic common sense fact, it's an environmental load that wears at the joint. Second aspect, and I'm passionate on this too, we are deconditioned. We are following the internet, computers, our whole society, including our kids, have changed. And it drives me nuts when I see, I can look outside, I don't see kids playing outside. I see them on computers. They don't run anymore. I mean, Sonia, my little daughter, we were at the beach recently, and she had a little friend who came, and he was 8, she's 6, and she looked at him and said, "Chase me, let's run." And he goes, "Is there any computers here to play on?"
No way. Are you serious? On the beach?
Yeah,
That's
the funniest thing, Jani, is, not to cut you up, but what was amazing is this 8-year-old was huffing and puffing after 2 runs, and Sonia was going, "We only did this twice. Let's keep on going. I'm 6, you're 8. I'm a girl, you're a boy." So it's, those 2 factors, I mean, if you want to sign up for a joint replacement when you're 25, start killing yourself. start not, be a victim of the media. But Jani and I are here to teach you that you don't need to be a victim. You can make a change right now.
Well, what I just read is shocking. I just read on that during the holiday season, 75% of our that's where 75% of our annual weight gain takes place. 75% just during this holiday season, which is just right around the corner.
Are you serious? 75%?
Yeah. 75%. And according to Fox News, they had this article, U.S. obesity rate reaches new high. So in 2014, it still stands at 27%, according to a new Gallup poll. Okay, in 2013, it was 27.1%. So we've actually got increased. It's just increasing, and we need to do something about it. And it just seems like we're not fixing the problem.
You know what we're doing on the orthopedic level? Everyone in the world is going nuts and literally saying, why is the rate of joint replacement so high in the U.S.? I mean, it's a demand on lifestyle, too. In different countries, because you are expected to do what you do and you live with pain here, we have the privileges where we can live the way we want. We can live happy. So in order to live happy, instead of correcting the underlying issues, people correct it with the ultimate solution, surgeries. And imagine, you know what a knee replacement is, or a hip replacement? A hip replacement means I make a huge cut, not a pretty cut, over your knee or over your hip. I dislocate it, and then I cut the bones out, cut the surfaces off, and then put an implant on. And that's a fairly drastic procedure that people are lining up right now and saying, can I have that joint replacement? I heard you're good.
It's ridiculous. It's absolutely ridiculous. And what's so scary to me is that there's so many things that need to change in order for people to wake up and start losing weight. Our schools need to change with their curriculum. We need to be adding in more exercise. Exercise is getting cut in our school systems. So kids aren't even exercising. Parents are working. They're double family incomes. No one is making the children accountable for exercising. Our food industry, it has taken over.
So, I mean, we've got a lot to keep on talking about in our next segment, and I think we'll this is nuts, and I feel bad because this obesity epidemic is killing us. It's killing us. And we'll talk about how the media is selling and pushing all these diet fads, inclusive of sugar in our foods. So stay tuned for our next topic and our next segment, continuing on this silent killer.